background is the second leading cause of cancer death worldwide.
The two-day conference will provide a forum for exchange of ideas and authoritative views by leading scientists in discussing ways to improve quality and quantity of cancer research, not only in the country but in the region as well.
The initiative we just mentioned about...
Speaking while officially opening the conference, Dr. Mohamed Kuti, Governor Isiolo County and Chair of the Council of Governors Health Committee, noted the need for research to reduce the number of deaths that are caused by cancer in the region.
If we are to reduce these numbers, research comes in handy. Through research, cancer experts can understand best what ails the community, the prevalent areas, and devise countermeasures to reduce new cancer incidents, improve timely diagnosis, treatment, and untimely increase in survivorship.
He continued to outline the main challenges of treating cancer in the country.
The main challenge remains the distribution and access to these specialists by Kenyans who need their services out of the few cancer specialists in the country, where nearly 90% of them practice in urban areas, and particularly Nairobi, and the other 10% in Mombasa and Eldoret, leaving out the rest of the country, which has a constant growing cancer burden. Kenya has less than 30 cancer specialists against an increasing cancer population of 43,000 cancer patients, which means that every cancer specialist should attend to at least 1,300 cancer patients, which is a dire professional deficit which clearly requires urgent attention.
Cancer. And as you can see,
while acknowledging that indeed health is a devolved function, he mentioned the role played by the county governments in building capacity as well as creating awareness on cancer diagnosis.
County governments are trying their best in disseminating relevant information and education, cancer screening, early diagnosis, referrals, and management of terminal cases. However, more work needs to be done to enhance capacity at the county level through decentralization of facilities for cancer diagnosis and treatment, training of service providers, generating evidence on disease burden through research, as well as increasing population access to such facilities and thereby reducing costs incurred by households in seeking cancer treatment.
Globally, a total of 9.6 million cancer-related deaths have been recorded so far in 2018, and of this, 70% have been in low or middle-income countries. According to the World Health Organization report in 2010, the global economic impact of cancer was estimated to be $1.16 trillion US. Closer home, 48,000 cases of cancer are diagnosed annually, with breast cancer recording around 6,000 new cases, cervical cancer recording 5,200 cases, esophagus cancer having slightly over 4,000 new cases, prostate cancer recording 2,800 cases, while cancer of the colon and rectum recording slightly 2,000 new cases.
To address the cancer burden in this country,
Dr. Alfred Karagu Maina, Chief Executive Officer of National Cancer Institute, outlined the cost of cancer to the economy.
From the cost of treating it, as I think I had mentioned about how much it costs to treat, so that's a direct implication. I would look at it also from the perspective of lost productivity. Those people who have cancer and some of their loved ones will have to miss work, will have to fail to do their day-to-day activities and attend to this, to this person, to the cancer patient. When you are talking about cancer treatment, you are looking at three main modalities of treatment: surgery, chemotherapy, and radiotherapy. So the three combined, it is estimated that in a public setup, it will cost a patient about, I think it was about 300 and something, between 330 and 350,000 for one case. Of course, that would be very different in the private sector. In the public sector, if I remember correctly, it was being estimated at about 40,000, I think for cervical cancer or both of them. On average, it will cost about 40,000 to have a diagnosis.
This resulted in this agent.
He went on to state that they were in the process of decongesting the largest referral hospital, Kenyatta National Hospital, by creating specialized cancer treatment centers in different counties.
Majority of our population are not very, are probably living in rural areas, maybe even are living below the poverty line. That, of course, is a challenge. And that's why now the role of NHIF comes in, because when people have to pay out of pocket those huge sums of money, then it becomes a problem. What we are working on is to decentralize access to care. So we are trying to see how we can have as many centers as possible, preferably even outside Nairobi. So currently, remember I talked about 3 modalities: chemotherapy, surgery, and radiotherapy. When we talk about chemotherapy, which a good number of patients will require, right now we have a number of our county referral hospitals that have chemotherapy units.
The call is to all key players and stakeholders to work together in an effort to ensure that information about the chronic disease is disseminated in the various communities, reducing the economic burden it represents. Reporting for Brand Plus TV Business News, I am Daisy Wambua.